Well, a warm welcome to today's talk, Sunday the 22nd of May. Now, we might be looking at some UK data later on. We'll see how we go for time, but I want to start off with North Korea and China. Now, it's a curious irony of history, really, that this pandemic began in China. It began spreading in China. And it will also, the last major outbreaks will also be in China as well, because they're trying to delay the inevitable, but the inevitable will come. So while the rest of the world is in hopefully a very tranquil, peaceful, endemic state as they go into this period of endemicity with the virus, there's going to be a major transmission in China. That is quite inevitable. So it'll be the last country to have major transmission, and it was the first country to have major transmission. Quite ironic. Is ironic the word? I'm not sure. It's just a pity that it wasn't contained in China to begin with, as the World Health Organization could have done if they'd stopped all the flights at the early stage when, on this channel, we were advising that very thing. But that's counterfactual history now. We have to stick with what we've got. So let's look at North Korea first of all. Terrible situation in North Korea. President Biden with President Yoon Suk-yeol, this is the president of South Korea, both made this offer. So this is from President Biden. We've offered vaccines not only to North Korea but to China as well, and we're prepared to do that immediately. Now, the vaccine capacity in the United States to produce vaccines is absolutely huge. They could do this on a massive scale. There's huge amounts of vaccine spare, and I'm sure they could ship a few military cargo planes there basically overnight. But of course they won't accept it. It's a pity. Now, we can argue about vaccinations till the cows come home, but there's no question from the data I know that for people at higher risk and for the older age groups, vaccine is the safer option. Now, we can argue about younger people, and we could argue about multiple doses, but getting a couple of doses into the elderly and the most at risk would save innumerable lives in China and North Korea, but the leadership, unfortunately, is refusing to do that so far, which is a tragic situation, of course. So this, again, talking about North Korea, they've declined offers from South Korea and others already. They've declined offers from covax. North Korea has declined. Now, symptomatic cases, 22,000 symptomatic cases in 24 hours in North Korea. And just write these because I get North and South Korea mixed up. In North Korea, 2.5 million people have been sickened by the fever already. Now, this tells us that the fact that they're talking in these terms, talking about fever, and presumably they're looking for other symptoms as well, but this tells us that they're diagnosing symptomatically. They don't have the testing capacity. So they're diagnosing this on symptoms. And the vast majority of people with the symptoms and with the fever will in fact actually have COVID. Because remember, this is a population that's not been vaccinated. They are completely naive to the virus. And that's why it's going to go through with such speed and devastating effect, unfortunately. Interestingly, this data here from North Korea, these 220,000 cases in 24 hours, does sound reasonable for the population of 25 million. The 2.5 million people affected, okay, it's going to be much more than that, but that's symptomatic, remember, so we can probably add at least 40% to that for 40% to that, at least for people that are asymptomatic as well. So why North Korea has suddenly started giving accurate information about this is a complete mystery. Are they, I don't know, are they trying to get help? If so, they're just turning it down. Is this for domestic consumption? Well, they control the news domestically. It doesn't really make sense. All of a sudden, they've started being honest about these numbers, and absolutely nothing else. Now, they say there's 750,000 people under treatment. In North Korea, that is not possible. They simply do not have the capacity for that, so that is a lie. They cannot do that, or unless treatment's rinsing your mouth out with salt water or something, in which case it could be. But because they're short of medicines, they're very short of oxygen, there's frequent power cuts, they're short of electricity, and they're very short of fridges. And they're claiming 66 deaths, which of course is nonsense. It's got to be way more than that already. And we'll never know, unfortunately, the numbers of people that are going to die in North Korea, but it's going to be large. But we're never going to know the number. It's going to be an awful lot of people getting very sick and dying in North Korea because they have no immunity to the virus at all. There's been some small outbreaks, so there's going to be some natural immunity, and I think we can assume that the president and his family have been vaccinated. But other than that, the rest of the country won't have been. So anyway, they're carrying on with a nationwide lockdown, which isn't going to work. They claim that it successfully kept COVID out for 2 years by sealing the borders. So if you can seal the borders, keep COVID out, then there's no need to vaccinate the population. Just don't bother. I mean, what sort of thinking is this? It is totally inevitable the virus is going to get into the country. There's cross-border smuggling all the time between China and North Korea. That's how a lot of people survive. They're getting things from China. And the idea that you could keep it out indefinitely is ridiculous. But the border sealing measures that they have taken have devastated many, many poor people in North Korea. It's been a terrible situation for them. All for nothing, because now it's spreading through, well, you could argue they've delayed it till Omicron, that is one thing. But it's now going to spread through the entire population. They could have used that time to use vaccines from the WHO or the United Nations, but they didn't. State media is advising herbal tea. Now, I don't know what herb they're using. This may work. It may be effective to some degree. Don't know. There's a lot of different herbal teas. Gargling with salt water might have minimal effect. I would have thought gargling with iodine would have had more virucidal effect. But anyway, ibuprofen and paracetamol is being recommended. But I believe... Now, ibuprofen was recommended by the UK medical authorities. I believe they're wrong. There's no evidence that I'm aware of that ibuprofen is antiviral. There's no evidence that I'm aware of that paracetamol is antiviral. All these things do is treat the symptoms. In fact, we can say that ibuprofen and paracetamol are not antiviral. And I believe we can also say that fever is part of the body's natural immune response. Why would you want to eradicate the fever? So I think this is contraindicated, but you've got to follow the advice from your own doctors and your own health authorities. But that's my view on that. And of course, there are no antivirals. That goes without saying. Kim Jong-un officially bungled. Yeah, so it's not Kim Jong-un's fault, of course. The officials bungled the distribution of National Medicines Reserve, and if they got the National Medicines Reserve all out properly, everything would be absolutely hunky-dory. So not the president's fault. It's these bungling officials. Presumably, a few of them will be executed as punishment. They have mobilised 1 million health workers, we believe this is true, to find people with symptoms, and they are being quarantined. Now, we don't believe they're being tested because they don't have the testing capacity, but they are being quarantined, and it appears to be a bit of a China-type model, but it's so patently not working. So the virus will spread through the country. It's going to cause lots and lots of people to get sick. There's essentially no medical facilities to treat a lot of people all at the same time. There's a lot of untreated comorbidities as well. There's a lot of diabetes and high blood pressure and things that aren't treated already. Thankfully, they don't have much obesity in the country, which is a good thing. But there again, that's more than offset by the malnutrition, which of course causes immunosuppression. And it's not just current malnutrition due to the economic lockdown of the past 2 years. It's long-term malnutrition, which has long-term deleterious effects on immunity. So, terrible situation in North Korea. China, now Dr. Michael Ryan, head of emergencies at the WHO, these are direct quotes. We understand why the initial response of China was to try and suppress infection. Well, do we? Okay, Dr. Ryan does anyway, I'm not so sure. But the maximum to the maximum level, but that strategy is not sustainable. So even WHO coming out clearly saying that this strategy will simply not work. It's just bemuses rationality that this is carrying on, this zero COVID policy in China. A suppression-only strategy is not a sustainable way to exit the pandemic for any country. We agree with Dr. Ryan. And then he went on to talk about unchecked transmission in North Korea and Eritrea, which of course is also a bit of a hermit kingdom, could spur the emergence of new variants. Well, yeah, but I don't see why it should more than anywhere else, to be quite honest. And so far, most of the new variants have come from the South Africa region. Certainly in terms of the Omicron and subvariants, seem to have originated in the southern African regions. So I'm not quite sure why unchecked transmission should lead to new variants. Now, of course, any time the virus is replicating, that there's going to be mistakes. But of course, the virus is replicating in Western countries as well. So quite what Dr. Ryan's thinking is there, I don't quite get it, and I'm not sure I quite agree with it, actually, because the most transmissible variant will predominate, and it is Omicron, of course, in China and North Korea, and that will predominate because it's romping through a population that are completely unprotected. Well, in China, there's partial protections from the vaccines. In North Korea, they're completely unprotected. Anyway, this is talking about China. Dr. Tedros said this week that zero COVID is not sustainable. Now, if you're getting a bit of deja vu there, he said exactly the same thing last week. Now, I agreed with him last week, and I agree 100% with him this week. He said the same thing twice. And of course, Dr. Tedros and China are quite chummy. So for Dr. Tedros actually to contradict the policy of China is quite a big thing for him to do. It's right that he does contradict the policy, but of course, if he didn't contradict it, it'd have zero credibility left altogether. It's so patently the wrong thing to do. So we agree with the WHO on this episode. WHO is deeply concerned at the risk of further spread in North Korea. True, but that's inevitable. Worrying numbers of people with underlying conditions in North Korea. Has asked North Korea to share more data. No response on that. WHO has offered vaccines, medicines, tests and technical support to North Korea. No response. So there we go. WHO concerned about China and North Korea. Now, I think I'll just tell you a couple of things about the UK, and then I'm not going to go into detail now because I want to read you a letter. In the UK, Britain reduces its COVID alert level from 4 to 3, so it's less serious. Omicron variant wave of the virus is subsiding now in the UK, which is good. Omicron BA4 and BA5 newly classified as variants of concern. Now, this is I wouldn't say worrying, but slightly more, probably just interesting rather than concerning. Now, the report on the variants only comes out every month in the UK, and we're not doing another one for a couple of weeks, so this is kind of an interim report. But the BA4 and the BA5, which has taken over in South Africa, is now a variant of concern in the UK. We've noted that the BA4 and the BA5 on a video we did about this recently has taken over in Portugal and other parts of Europe. It's now the predominant strain in Portugal. Looking like it's outcompeting the Omicron BA2 and possibly even the BA2.12.1, which means that the BA4 and the BA5 could potentially also become predominant in the United States. Not particularly concerning, not more pathogenic as far as we know, but people who've had BA1 are seeming to get reinfected with BA4 and BA5, even if not getting very sick. So the immune escape is the more serious concern with the BA4 and the BA5. I'm not going to go through all the ONS data now. I think we'll leave that for tomorrow. I just want to finish with this letter here from Christina in Shanghai. Now, I am in contact with quite a few people in China. Obviously, Christina isn't his real name. This has to be done confidentially, but I do know who these people are myself. These are genuine. Right, so Shanghai. I can confirm what you mentioned in your last video about whole floors being taken away. A colleague's building had one infection on floor 29 and everyone who lives on floor 28, 29 and 30 were taken into an isolation facility, forcibly taken. So one positive case resulted in around 30 to 40 people being taken away into isolation. Christina says, our family and children's safety is no longer solely in our hands, but the neighbours who we've never met before. If one person falls sick, we all get taken away. If your apartment gets disinfected, now why on earth are the Chinese spraying lime on the streets? Why are they disinfecting pavements? Why are they disinfecting public furniture? This just doesn't make any virological, epidemiological sense. This infection is almost entirely transmitted in the air. It's a droplet and aerosolized infection. And yet they have this mass disinfectant facility spraying these horrible chemicals everywhere. Just again, it's very frustrating, the non-medical sense of this. If your apartment gets disinfected, all sensitive materials, furniture, clothes, and especially electrical equipment are ruined. Not to mention creating a fire hazard by disinfecting electronics. It just makes no sense. If you refuse to leave and lock yourselves in at home, the police will knock down your door with force. Food supplies are improving in some areas, but a lot are still reliant on government deliveries or group orders if lucky. There are unannounced silent periods, and unannounced silent periods, and you may not receive any deliveries for between 3 and 5 days, so they can just stop for 3 to 5 days. And of course, people are confined to their homes, and they can't get out for food. There is no notice when these silent periods may happen suddenly, so any deliveries which were scheduled are cancelled or delayed, and food can be left outside and go bad in the hot weather. The latest thoughts suggest that things will start to open up in June, but they said it would be April, and then May, and now June. Nothing can be trusted. We just have to wait and pray that this nightmare ends soon. So they just seem to keep putting the date of reopening back. And it's been weeks now. It must be, is it about six weeks now? It's terrible. 6 weeks now or something like that. I hope things get better before the winter, when it will be even harder to contain the virus. Well, by then, hopefully they've realised you can't contain the virus. I'll just show this picture here that we've showed a few times. This is King Canute demonstrating that he cannot hold back the tide. So King Canute was wise enough to realise he couldn't hold back the tide, and yet the tide of Omicron, they're trying to hold it back, but it's simply not possible. The analogy is a powerful one. But of course, we're talking about people's lives, and we know that many people in Shanghai have died because they can't get out for routine medical treatment, because all the other diseases don't go away. The heart disease, the appendicitis, the gastrointestinal, nothing goes away. The gynecological problems, none of that goes away. That's all still there. I understand how low vaccination rates in the low vaccination rates in the elderly, but I've heard nothing about trying to get people vaccinated. There's no clear plan to get out of this. Direct from Shanghai, and I can give you attestation that is a correct email from Shanghai. So we'll leave it there with King Canute. When will these human beings learn that in the force of the natural created order, we are very limited in what we can do? Thank you for watching.